Men who have mental health challenges are particularly worrisome to me because very often they're in denial, substance misuse is a problem. Very often family violence becomes a bigger issue than with the female patient. And then, of course, suicide rates are much higher in men than they are in women.
I am so excited to interview Dr. Jain today. Rakesh Jain is a psychiatrist that I follow on social media. I follow in professional conferences. But today we're really going to be talking about kind of that balance between taking care of yourself with various ways that you can do that and professional help and taking medication from your psychiatric provider. So let's start with just kind of a professional introduction of who you are and your credentials.
Sure. Thank you for letting people know that I'm a shrink. But I try not to shrink people. I want the opposite of shrink. I want growth.
Yeah.
So who am I? I'm a physician. I used to be an oncologist before I became a psychiatrist. And I came to psychiatry because I didn't want to treat disorders. I wanted to help people. And psychiatry was a very good fit with me. And right now I live in Texas and I'm an academic professor, but also very much in real life like you are.
Yeah.
But my passion isn't helping one person at a time. My real passion is growth. That's why I think our conversation is going to be a lot of fun because even though we're both prescribers, we see the limitations in it. And how can we move away from just relying just on medications to maybe using medications the right way so that our growth is unimpeded.
And that's the title of the podcast is Embrace the Journey. We're all on a mental health journey, and whether you acknowledge it or not, and I know you do. Tell us a little bit about your mental health journey of what you do for yourself.
I like that question very much. I don't get asked that often enough. So I've had some significant challenges with mental conditions myself from a pretty early age on, maybe from the age of 14 on, never realizing that was what was wrong with me. But over the years, entered into psychotherapy. That was really, really helpful. For the first time ever, I understood I am not my mind. My mind is with me, but I'm not my mind. And how you can do things with it. I also was on psychiatric medications for a while. And I saw the strengths of psychiatric medications. I saw the weaknesses of psychiatric medications. But in the last 20-some years, my journey has taken a decided shift into mental wellness. And mental wellness by itself doesn't say that you can't have mental illness and mental wellness at the same time. So where has my journey taken me? I have now created our own wellness program that we use in our clinic. We call it the Wild 5. I'm happy to tell you more about that. WILD 5. But more importantly than the program is the concept, is the acceptance of the fact that we human beings aren't designed just to live a life with no problems. Our goal is to have minimum problems, but if we are so unlucky to have a problem, what can I do with that problem to grow? So my journey has very much been in a two-level. I am interested in helping people with psychiatric disorders, but I'm also very interested in taking them not to just recovery from the psychiatric disorder, but to the flourishing of the human being.
Yeah. I'm so glad that you're willing and vulnerable enough to share just personally, because I think a lot of times people look at professionals or successful people and say, oh, they don't have the struggles that I had. Talk a little bit about maybe some difficulties for men and, if there were cultural barriers to actually admitting that, you could use some help.
There are. And particularly men of certain minority traditions, like I'm Asian, there's a very strong pressure culturally not to admit to having a psychiatric disorder. This is true in the Latina culture, this is true in the Black culture, is in fact also true in the white culture amongst men. So interesting you bring that up because I'm about to partner with National Public Radio to do something on that, men and depression. I have never, other than the first couple of years, hidden my mental health challenges because there's nothing to hide.
Yeah.
If I hide it, though, then it becomes a problem. What is there to hide? I would never hide the fact if I had, colon cancer. I would never hide it. So I decided maybe 3 decades ago, my mental health challenges and my mental health wellness are who I am. Nothing to hide. That's been good for my patients.
Yeah.
That has been good for my patients. It's been particularly good for men because men often put physicians on a pedestal, and to be, as you said, vulnerable has been very helpful. Men who have mental health challenges are particularly worrisome to me because very often they're in denial, substance misuse is a problem. Very often family violence becomes a bigger issue than with the female patient. And then, of course, suicide rates are much higher in men than there are in women. I think we could find ways by having conversations like this to normalize the experience of depression. No one wants to get depressed, but if you are depressed, to come out and talk about it allows for two things. It allows you to get the help you need, but also allows other people behind you not to hide in shame. And that's perhaps the message I want to share with people.
Yeah. So tell us a little bit about the limitations that we have in psychiatry as far as our medications. Still listen to your psychiatrist, still work with your provider, and then we'll build on that with your 5 pillars.
We could.
Yeah.
Or sometimes even that could be the first thing. I don't think we should automatically lean into going to a mental health professional just because you have a mental health challenge. I think society has a big role to play in helping us. Our families have a big role to play. We have a big role to play. I'm a kind of an unusual psychiatrist in that I don't think psychiatry should be accessed immediately, only if it's necessary. So mental wellness and mental resilience, which we haven't touched upon much, is highly learnable skill.
But we don't teach it anymore.
We don't teach it.
So
we used to.
Yeah.
We used to. So I'm not religious, but I've been exposed to a number of religions because I grew up in India, and by default I got exposed to Hinduism, Jainism, Sikhism, Islam. And what was so interesting is there's not a single religion I've ever encountered that didn't learn that resilience is part and parcel of religion. But we have become less spiritual, less religious. We don't socialize much in groups. So to me, when a psychiatric difficulty arises, I think the first question ought to be, what can I do to better integrate into society? Because most people pull away from society. Sometimes that is enough. I've had a fair number of people who have gotten to where they need to because they've accessed their social networks. Maybe they've joined the Toastmasters, they've joined etc. But if that fails, then accessing psychiatry is important. It is true what you said. There are limitations to what we offer.
Well, and just to back up to that spiritual health, this is another one of my pet peeves, is that because we have this fear of proselytizing a specific belief system, we are not addressing spiritual health in mental health. And it really is an integrated piece of who we are.
So well said. Why would you want to deny it? Even people who are atheists, which for maybe 2 decades of my life I would have identified as an atheist, we still have a spiritual life.
Right.
So there's no automatic conflict. Whether you're a follower of religion or not, I think that existentialism is part of who we are. And when we lose that, our mental health suffers. Like, for example, connection with nature, connection with the environment, connection with something that's greater and bigger than you does not require religion. And I 100% want to support what you said. It is to our detriment that in mainstream psychiatry, we push that aside. I, like you, explore that with my patients. And if it's atrophied, then I find ways to encourage them to develop it on their own. I don't want to proselytize them because I have nothing to proselytize them for. But I want to give them the understanding that is an important part of you. Why are you denying yourself that?
Yeah. One of the things that we do is we ask in the thought map of like, how does this impact your spiritual relationship? And, many times people will abruptly, I don't believe in God. Clearly there was some reason for that, or there's trauma there. It wasn't a gentle response. So we help identify like the spiritual conflict. So you were presented, your spiritual self meant a religion that you were taught. And then you separate it as something you don't want in your life, where we are spiritual, energetic beings. So anyway, love that you are also, addressing that. And what do you teach in your wellness program?
So the first thing we talk about is ask people to evaluate themselves if they have a wellness deficit disorder. It's a very great exercise. It's a wonderful exercise because by definition, we all have wellness. Even the most ill person has wellness. The question is it optimized to your liking? So me and my research group, we looked at what are some of the elements that humans really crave when it comes to wellness. And we identified 4, based not on our belief system, but based on what the literature showed. And those are called, I think you might like it, the HERO, HERO, hero wellness traits. So the question is, how big is your hero? H stands for happiness, E, enthusiasm, R, resilience, O, optimism. And then, of course, we take these 4 and we create a 5th one, which is a holistic examination of your wellness. So we've created a scale called the Hero Wellness Scale. And it's sellable to you and your listeners if they would like it. We've also validated it to make sure that it has validity to other measures of wellness. It does. It's strikingly good. And it is sensitive to change. So if you, for example, are helping someone with improving their mental strength, mentally strong, it would be nice to know where exactly are they on a measurement-based care basis. If you have fever, I want to take your temperature because I want to see if it goes up or goes down. So we published a lot of studies with the Hero Wellness Scale. You're welcome to look at it. And we have studied patients with bipolar disorder, major depression, ADHD, even patients with rheumatoid arthritis, because they often have psychiatric difficulties or emotional difficulties. We even studied college-age kids because there's a major challenge with wellness deficit in all of us, but our young people are really hammered hard. And then what we did is we developed a 30-day program that's self-directed. We wanted to take ourselves out of the loop. So we have published a couple of books. People can find them on Amazon that are guidebooks, 30 days. It's self-guided, but it's measurement-based, self-guided. And we have specific things we like people to do, 30 minutes of exercise per day. We measure socialization. We ask for specific things with sleep hygiene. We ask for specific mindfulness practices. So we have developed 9 mindfulness tracks that live on our website. And we ask our patients to once a day for 10 to 11 minutes, listen to a mindfulness track. So what we did, and you may find this interesting, at the end of 30 days, we've now studied it, I think 9 different studies to see if while all this sounds good, does it actually help? And what we found is anywhere between 25 to 74% improvement in wellness, no cost. This is a completely free program. 2, it's measurement-based, because if you don't measure it, then you're just flying on a hope, and that's not a good idea. And 3, what we did is we studied to see if after the program's over, does your wellness maintain itself? Because medications don't. And I'm really happy to report to you, wellness not only maintained itself, it actually fed on its own success. So in my own small way, I've been, even as a prescriber, very astutely aware I've got to do more.
I love this, and it goes into my next question about kind of lifestyle choices and neuroinflammation and how some of these wellness practices actually decrease neuroinflammation. In layman's terms, can you explain that to my listeners as far as the science behind wellness and your lifestyle choices?
Oh, such a great question. So we picked those 4 traits and the hero wellness traits, happiness, enthusiasm, resilience, optimism, because they're all connected to neuroinflammation. And we picked 5 interventions. So intervention 1 is exercise. It is incredibly protective against neuroinflammation. Mindfulness. And the data is quite extensive. We picked sleep hygiene. We picked socialization, and then the final one we picked was nutrition. We Americans are weirdly very rich in food, but we are in a state of poverty when it comes to quality food. So we picked the mind You may be familiar with the mind diet. Okay. So we teach the mind diet in our program, and then we actually look for compliance with it. We don't get 30 out of 30 days because we humans, that's not who we are. But even 11 to 17 days out of 30 days, all these interventions showed significant benefit. You talked about inflammation. Who has more inflammation than rheumatoid arthritis, folks? So guess what? Even in that population that is vastly inflamed, we saw that our 30-day interventional program, 30-day wellness program really did help. But I don't think it's that wellness program that helped. It's the basic ancient concepts of wellness. So that's why our program, we call it Wildfire Wellness. And the tagline is ancient practices for modern day living. I actually don't think in the last 100,000 years, we humans have come up with new wellness techniques. I don't think we have. We already know what helps us. It's just a matter of reminding ourselves because we forgot.
Yeah.
Which may be the reason why
the
mental
motivation. I know
Yeah.
100% what, exercise does.
Yeah.
But when I'm feeling down and woe is me and, why?
Yes.
Why get up and make that decision? And I do, but there's days that I don't.
Sure.
And so I also teach a lot of grace for yourself as you're going through these things. And sometimes it's a combination of doing medicine for a while and then maybe coming off. Some of my patients don't have the opportunity to come off. They do need to stay on medicine. So just that balanced approach of, figuring out what works for you, that we're each responsible for our own journey. And I think as one of the stressors as a provider is this idea that they can come to me and I can fix it. And it's often a combination of so many things that have gotten somebody to the point of symptoms of mental illness.
Yes.
Yeah.
Yes.
So how do you're in a spot of, kind of having this academic persona. You probably have a private practice that's cash pay. We have an access type practice where we accept everyone, we accept Medicaid. And so the gap of what that personal responsibility and trying to get patients to understand that. Any tips for our listeners, for me as a provider, to meeting people where they are, but also trying to get them to see the big picture?
I love that. I think I can answer that two separate ways. We ask our patients to be patient, but I think it's probably as important for us to be patient.
I need to work on that. That's definitely on my list of things I'm working on.
Me too. Because sometimes my feeling is, by God, I've seen the light. Why won't you see it now? Don't you know who I am? Just listen to me. But patience is really important. And to appreciate that even smokers who want to quit, they go through 9 failures before the 10th one works. That's the average. So why would wellness be any different?
Okay.
Most of our patients who have had mental disorders for a long time have genuinely forgotten, or maybe never even knew, that the goal of life is to live a fulfilling mental wellness-filled life. They may not know it. Who am I then to make the assumption that the moment I tell them, they will get it? So the first thing I tell myself is, you are like a farmer. Your job is to plant the seed. Your job is not to germinate. That's the seed's job. If you overwater that seed, you will drown it.
Okay, thank you.
So you plant the seed and you come back and check on it and you fertilize it and you water it occasionally. You don't throw a bucket full of water or fertilizer on it because you'll choke it. It is always the truth that flowers and plants move towards sunshine. It's a law of nature. The law of nature for us human beings is we always want mental wellness. We don't have to make any assumptions that our patients don't want mental wellness. They do. They're designed that way. It's just that they're blocked. So then what's the block? Often it's they don't even know. Number 2, the block could be the psychiatric illness is so challenging. So sometimes me and my patients say, I want you to try the Wildfire program, but after 3 months, let me reduce your panic attacks, your mood symptoms, your drinking difficulties. But I want you to know, dear patient, I want to think big. And I want you to join me in thinking big for you. We may not get there today, but so what? We'll get there. So when I set that roadmap as early as possible, then I don't face resistance from patients in 3 months who say, but my panic attacks have stopped. Why do I need to exercise? Why do I need to meditate? So setting the roadmap can be very helpful. Would you like me to give you another quick example? Yes. My wife is a type 1 diabetic, and she's been one for 35 some years. So when we used to go see our diabetes doctors, they said back then, if you can only achieve a hemoglobin A1C of 9, that'll be a very good thing. So we worked hard to achieve 9 because that's what our clinicians told us. 5 years after that, they said, if you can only achieve 8. So guess what? We all of a sudden raised our standards. Now they tell us, let's achieve 6.5. Guess what? We hit 6.5. But it was the clinician who set the roadmap for us. In mental health, we often set too low a standard for our patients, which is, I want to get rid of your quote-unquote problem. And we don't always remember that the flourishing of the human spirit is as much my job as a prescriber as it is anybody else's. How does that sit with you?
I love that. And I hope that I'm doing that, but probably not every time. Sometimes I just feel like there's a dependency mentality, or it's like who they are rather than what they're struggling with. But I think that's a cultural problem. One of our mission is to revolutionize the culture of mental health. And I think it's an American culture of mental illness, of being like that's who you are. And it's really just what you have, just like your wife has been challenged with having diabetes, someone else has been challenged with this bipolar disorder, but it's not who they are.
That's right.
And switch, trying to switch that. But I try. I try. Yeah.
We all do.
Right.
There is no such thing as perfection. Maybe that is also very helpful to us as providers, but it's very helpful to our patients. But having said that, that's not a reason not to keep aiming. And what I have found in my own personal journey is I am not ever hoping to be at the right mental wellness place. I just want to be moving towards it.
Right.
And when I tell that to my patients, I'm right with you.
Yep.
I struggle with meditation. I really do. But I tell them what tricks I use. And I tell them, hey, it's okay for you to use it more when you're feeling more panicky, more depressed. In time, it'll become a habit. I never give up. Maybe that's the one trait I possess. I don't give up. And I think I don't give up because my clinicians, when I was not doing well, I was an awful patient. I was not adherent with their advice, with appointments, etc., etc. And this wonderful psychiatrist, her name was Dr. Strhilovich, she was my psychiatrist, never gave up on me. And I was like, once I got a whole lot better, I was like, I'm going to repay her by paying it forward. So I never give up. And you may find this interesting. I never give up, even in patients who sadly died by suicide. And you might say the story is over, but I don't give up even at that point because there are things I can learn from that situation. There are survivors. I just don't give up. And I do it only because somebody did that for me. So I feel it's an obligation to continue that. And that's what I tell my patients. I know you don't feel that you are doing the Wildfire program, your program, whatever program it might be, but I'm not going to give up on you. Because I believe that you will get there. When we get there, we will see. But I know just the way. This is the law of nature. Trees go up. The law of nature is you want to grow. There's blocks. We're going to find ways to solve it.
And that's what I always say to people. Don't give up on yourself. And I wanted to touch based on wellness teachers that are on social media and publicly teaching of wellness exercises of different varieties, from cold plunges to vitamin supplements to meditation. That I give this is going to cure everything teaching. How do you support some of those practices, but also give the reality of that's not true?
We as human beings tend to gravitate to ideas, and we bounce from idea to idea. I often ask my patients if they come up with an idea, cold plunge. I'm like, what's wonderful? What do you want to achieve from it? What if you don't get what you're looking for? What's the backup plan? Are you okay with doing 2 or 3 things at the same time? So I really have had patients who say, I'm going to go to Colorado and I'm going to do psilocybin and I want to stop my 5 medications. I never tell them it's a bad idea. Who am I to know it's a good idea, a bad idea? What I tell them is, how about we do it the safest way possible? How about we have backup plans? How about we make sure that if it doesn't go well, what can we do? If I am overly critical of what they're thinking, they then learn the art of shutting me out. So no matter how wild I think the idea is, my first approach is interesting. Second thing is, I'm so glad you're seeking. The third thing I bring up with them is, how about you and I actually examine the value and the risks and dangers together? So when my patients feel more respected in that way, now they tend not to make overly incorrect decisions.
Well, and I want to stop and say, if you are considering any kind of psychedelic experience and you are on medication, please talk to your provider about that. And hopefully, like you said, there can be that respectful relationship. But let's talk about, we only have time for one more question. Psilocybin, the promising and the fearful of doing it on your own. So that I know you're following and even doing some psychedelic research.
Yep, quite a bit.
So talk about that real quick. And then the concern of people going out and doing an experience with a shaman or a non-medical provider.
Yeah, it's an interesting dilemma because I have a lot of people I know, patients, non-patients, who've actually worked with shamans and gotten great benefits. I've also sadly had the opposite, where they have gone not realizing there are drug-drug interactions. So psilocybin comes from nature. That is true, but psilocybin is a chemical and it can have pharmacological interactions at multiple levels with psychiatric drugs. That's why your advice, you're not going to hear me say it's a bad idea because it may be a great idea. What I will do is I want to go through the process of thinking it out. I strongly want to underscore what you said and support you in it, which is if you're considering doing it, don't exclude us from the conversation. We're not going to be moralistic about it. What we might be able to do for you is advise you about the strengths and weaknesses of that approach for you. Example, I've had a couple of patients who had bipolar disorder, very prone to mixed episodes. Those are people who have manic and depressive symptoms at the same time. While they went on psilocybin, they unfortunately have now developed a rapid cycling mood difficulty that we're no longer able to control. So I'm giving a scary story, but I also want to say psilocybin does have a definitive place. Pull your healthcare provider into the bigger conversation. Most of us are not anti this or pro that. We're only pro you, dear patient.
Yeah. And what I don't think people realize is, like you said, psilocybin is a drug. It works on the serotonin receptor. If you are on serotonin reuptake inhibitors, or if you have a disorder like bipolar, who are sensitive to serotonin, agonists.
It could be a challenge.
So
it could be a challenge.
It's not this miracle thing that everyone just has an experience and now you no longer have any symptoms.
Yeah, but measure it out. And again, involve us. Most of us, and you and I probably fall in that group, are not anti, not pro. We are, however, pro you. So when we give you advice about should you not, if you do it, what steps you can take to minimize your risks and maximize your benefits, we're speaking from experience. We're speaking from data and from knowledge. Take advantage of us. We are on your side.
Yes. So tell us about your research. What is evolving in
wellness?
In psilocybin psychedelic for depression.
Yes. It's not just for depression. Depression is wonderful. It's looking very promising. It really is. So we're looking at both regular depression and treatment refractory depression. Some of my colleagues are looking at bipolar depression with psilocybin. And in carefully controlled settings, we're seeing some unusually positive results. But that's not as interesting, I don't think, as looking at what happens in the brains of people who are taking psychedelics. Because to understand the biology of why these may work or harm, probably important. So some of our imaging studies are now showing us the pathways through which psychedelics, which only last a few hours, why is it sometimes they can last for 2 months, 3 months, 20 years. I have patients, I really do have colleagues, they're not patients, who took a single psychedelic 50 years ago and who still 50 years later are able to use that experience for their benefit.
Yeah.
But I also have patients who've done psychedelics and who've gotten no benefit and they get very frustrated. So we're trying to better understand this.
Yes. Thank you so much for taking the extra time to talk to us today. I could talk to you forever, but we will end today. But thank you. We'll definitely have the link to your
Sure.
clinic and the material on the Hero, and we'd love to correlate that. I'd love to have some sort of assessment tool that we're using for that wellness for sure. Thank you so much.
Thank you very much.
Yes.